Hi, how's it
Hi,
going?
good. How are you?
Good, good. Thanks for joining us. My name's Dave Connor. I'm a public information officer with Pinellas County, and we're very lucky today to be joined by April Lott. April is a licensed clinical social worker and is the CEO and president of Directions for Living. That's a local community mental health organization, and they've partnered with Pinellas County to host an emotional support call-in line during the COVID-19 pandemic. Anybody in the county can call. The number is displayed in the information on this post, and it's available 8 a.m. to 8 p.m. 7 days a week. And they have a pretty big staff that we've been talking about. And today we'll talk about what that line does, who they're hearing from, what people are talking about. And if you are watching this and you have questions, you can put them in the comments of this post, of this stream, and April will try to answer them. No promises, but we'll do what we can. So, April.
Yes.
How many folks do you have staffing this line?
Well, we have approximately 250 employees at Directions for Living. We asked for quote unquote volunteers for this purpose, and we currently have about 48 to 50 staff who are working shifts to make sure that all calls are answered.
Wow, that's a lot. But I mean, I imagine just from watching the news, from talking to friends, from talking to family, this is something that there's a great need for in the community.
There is.
Who are you hearing from generally?
It's across the board. There seems to be some themes with the age group, so to speak, of the people that are calling. Certainly the older, elderly people who are calling are really expressing concerns about isolation. Many of our seniors in our community are homebound to begin with. They depend on others to take them to the grocery store. They depend on others to deliver meals to their homes, and they're feeling an overall sense of isolation. They are also the age group that tends not to have a lot of technology. So, not familiar necessarily with computers, not familiar necessarily with, what we're using here today in terms of Zoom and being able to stay in communication with others. We're also hearing from people who have worked very hard over the years on a sobriety plan. So whether it's, not drinking, excessively, maybe they've been an alcoholic in the past and they have achieved sobriety and they're concerned about the isolation at home. We're certainly hearing from people who, I think one of the ones that I think we have found interesting, but it makes perfect sense, are people who have struggled with an eating disorder over the years. And again, social isolation, being at home, the stay-at-home order. Lots of people are kind of talking about this overeating, nervous eating, this continuous access to food, and what that might mean for them in the future. The one that we're probably hearing about the most, however, is really around grief. All forms of grief. People who have lost their jobs that they've had for 5, 10, 15 years. They've lost their work family. In many cases, their only social support and network group was when they went to work, especially in the restaurant industry and in the social, in the service industry. People are used to being around others, and so things like losing their job, losing their income, and things, that seem maybe rather small in comparison, but things like high school graduations, college graduations, graduations from the fire academy. We've heard about all of those kinds of things being things that they are, I'm going to call grieving. They are grieving the loss of kind of their rituals and their ability to come together and celebrate and support each other. Things like, people aren't allowed to go to the hospital right now. So if you have a family member that's in the hospital, even for something that's non-COVID related, you're not allowed to visit. You're not allowed to send flowers. You're not allowed to do the things that people typically do to help themselves feel a part of it, like they're supporting others. Um, the same is true about having babies. You probably heard in New York, even the fathers can't go in. So moms, are going in and having babies all by themselves. In Pinellas County, they're still allowing one support person to go in, which I think most people are grateful for. Um, we are hearing just from across the board fear, anxiety, all the things that you might imagine.
And um, so I mean, those are all very, very heavy topics. Many of them um, are with issues that are completely beyond our control. Much of this is beyond our control. What can you help me understand, and maybe help our viewers understand how do these conversations play out? Like, what if someone calls in and is expressing that grief, what kind of interaction might they expect, understanding that every call is going to be different?
Yeah, they're going to get a person on the other end of that phone that's going to be very kind and compassionate, and somebody who has um, the ability to kind of isolate what the specific concern is, and to try to work with that individual on a what I'm going to call a problem solving strategy, a strategy that might give them the ability to, after the call is over, to remain connected, kind of, grounded to where they are. And I would say lots of what's being shared is information, kind of paradigm shifts about, for example, a lot of people are calling with concerns about they're watching too much news, first of all. And, I'm not ashamed to say that we are encouraging people to stop doing that. We are encouraging people to consider twice a day that they allow themselves to get on any form of media, social media, television, newspapers, whatever, but twice a day, morning and afternoon, in order to keep up with, information that might be helpful, like stay-at-home orders and, curfews that are happening in Tampa and whatever. You want to stay up on the information that will be helpful to you. But we are encouraging people to dramatically limit their amount of kind of information streaming about COVID-19. But we're also helping, with just providing some strategies, deep breathing exercises, practicing with people on how to do deep breathing, talking to them about, when you have been fearful in the past, when you've had anxiety in the past, what kinds of things worked then, trying to come up with ways to re-implement strategies that they've used before. But I think overall, most people are just saying things like, I just needed somebody to talk to. And, thank you for talking me through it. Uh, you know, I think our number one, if I had to say the number one thing that we want to do for people is to validate their concerns. That age old thing that you heard in school, right? There is no stupid question, right? If you have the question, chances are, hundreds of people in our community have the same question. So, being able to help people know that they aren't alone in what's happening, and nothing's been more true, right, than that. And with this pandemic, we talked earlier, you and I just mentioned about hurricanes, and we're familiar here in Pinellas County with, preparing for a hurricane and kind of batten down the hatches and doing the things that we need to do to prepare for a hurricane. And in those circumstances, we are generally alone, right? It's our community that's facing kind of the crisis. What's true today is that we are facing this crisis with the entire country, quite frankly, with the entire world. And in some ways, that is helpful to people.
In the sense of we're all in it together.
Yep, we're all in it together. And what I'm thinking and feeling, others, not only in my own community, but across the country, are expressing the exact same, fears, concerns, grief, loss, anxiety, all of the things that, that people are feeling. The other thing, though, I want to say that we are also hearing is that people want to be helpful. And, that too has been somewhat of a surprise, right? That people would be calling an emotional support line to say, what do you think I can do to help? Like, I feel like I could be so much more useful to our community. Is there anything that you think that I can do, kind of thing? So.
And as a public information officer, as a crisis communications specialist, I've studied a lot of disaster psychology, how communities react in the wake of disasters. And one thing that is observed kind of across the board in disaster environments is that people help each other. You might watch science fiction movies and think that it's going to descend into chaos and dystopia, but really that's not the case. People look out for their neighbors, they share resources, they band together, they come together. And in this situation, that it seems like that's really complicated because we can't physically come together. We've been asking and mandating that people follow the CDC's social distancing guidelines. And you bring up an excellent point. That's actually one of the first questions that we got from our viewers is advice on how people can help others right now. So I've got an answer from the county, but what are you telling folks that you talk to who have that question?
Yeah, we're encouraging people to do a variety of things. Obviously, first and foremost is to stay home. That one of the most important things that we can do to help others is to follow the guidelines that our, Board of County Commission and our leaders are asking us to do. So we underscore that. But in addition to that, coming up with one thing that we're asking, encouraging people to do is to identify 3 people that they could call and check on every single day. And if they have the ability to do technology like you and I are doing, that they use technology. That if, it really is a game changer. Telephonic services are very, very helpful. And, we've known about telephonic services and crisis calling and, responding to people in crisis via the telephone. But I have to tell you, when you add the added layer of Zoom technology or Skype and those kinds of things, and you can see people, it really can be a game changer. So we're encouraging people to come up with a list of people that they could support, that they could call. We are talking to people about making masks. So if they have a sewing machine, if they have the ability to actually make masks, we're encouraging them to do that. The CDC has shared a template, if you will, for making those in a fashion that can be very helpful to others. We are encouraging people that if they have people in their neighborhood or people that they know, if they're going to kind of venture out to go grocery shopping, about helping to grocery shop for others, as opposed to, allowing an elderly neighbor or somebody with a compromised immune system to go out on their own, and really thinking about, ways that could be supportive. So, we've seen a lot of things like, I think it was in, it was abroad somewhere, they're doing, everybody at 8 o'clock comes out on their balcony and sings, and, people are showing up to applaud their first responders and all of those kinds of things. And So right now we aren't encouraging those kinds of things because they would really be against the stay-at-home type orders. But we are thinking, I mean, encouraging people to do things like write letters to the medical professionals.
Mhm.
And literally just you could sit and write 15 letters and put them in an envelope and send them to any hospital, that or any first responder, to the fire department. And believe it or not, when people get anonymous positive affirmations, just a simple thank you and I'm grateful for you, it makes the person who's sending it feel better, and it certainly makes the receiver feel appreciated and seen. I think that's the thing that I worry the most about right now is as a community, we are accustomed and really get benefit from being seen and from being heard. And in this time of crisis, finding ways to be seen and to be heard, I think are really important to people's emotional well-being and mental health.
Yeah, yeah, that makes sense. Um, another question we got actually a couple times is from I'll read the question instead of paraphrasing. Veterans like myself that struggle with PTSD are having a difficult time with isolation when we've been told before that isolation is unhealthy.
Yep.
So that kind of ties into what you're saying, and maybe this is also a good time to talk about what services the emotional support line offers versus what services maybe you're not the best ones to handle.
Yeah. Well, and to your viewers' question around, being a veteran and the isolation piece, he or she is absolutely correct. And that is true really of so many mental health conditions, depression and anxiety and PTSD, right? All of those we have traditionally encouraged our people to not isolate, right? To have a strong support system, to make sure that they are taking time to visit with others and to get out and not be alone with their thoughts and, those kinds of things. And right now, we literally have quite literally asked people to do the reverse of what they have historically been taught as a intervention or as a treatment. And so I do think that because we are staying at home, that in isolating as a social isolation that has been mandated, that we come up with ways to do all the things that I've kind of just said, even, and I realize that not all of your viewers are going to be able to have um, necessarily technology, but I'm assuming because it's Facebook that the majority of people that we're talking to right now have the opportunity to go on a computer or on a smartphone via FaceTime, and to encourage them to start a support group on Facebook. Try to push information out like, I'm a veteran, and trying to find other veteran support groups that are available to them via Facebook, and the be a part of the social connection that's happening remotely or virtually. I think is very important. And that's true for people who are living with depression, who are living with anxiety. Really get on a Facebook group. There's lots of Facebook groups, private groups and public groups that really are supporting each other during this time.
Yeah, and for anybody who was not with us at the start of this conversation, we're talking with April Lott, licensed clinical social worker and president CEO of Directions for Living. They're hosting the emotional support line in Pinellas County. The number is here in the description of this video, and we're just talking through kind of some of the issues that they've been helping members of the community with. We have taken a couple questions. If you have other questions for April, please put them in the comments on this video. April, another question that I've heard a lot has not been asked on this video, but I'm really curious. Is as a parent now, my daughter's 15 months old, so I could tell her anything, it doesn't matter. But as a parent of older kids, how have you advised parents, or how should parents be addressing this with kids of different age groups?
Yeah, we have gotten that question actually quite a bit on the emotional support call line. People actually calling to express concerns about their young children. So it's not a one size fits all answer. Children come in all various sizes, right, ages, and understanding of the world. As you said, having a 15-month-old is very, very different than having an 8-year-old or a 9-year-old. So, we're encouraging people to start with asking their children questions about what they know. Tell me what you're hearing about, this new illness, this new sickness that's going around, to try to find out where they are, and then asking them about how they're feeling, what their thoughts are. What we don't want to do generally is to assume children are feeling a particular thing. And then introduce that feeling when that wasn't the feeling they were having at all. For example, we've heard from some adolescents whose their biggest concern, if I can use that word, is their high school graduation. That that they've worked their entire childhoods to achieve, walking across the stage and throwing their cap in the air. And that opportunity, it looks like that opportunity might not be happening this June. Yeah. So we've heard from teens who were preparing for prom. They've had their prom dresses laid out for months, and now they're not able to go to prom. So the first thing is to find out what their child and or children are thinking and feeling to begin with, and try to start there as opposed to introducing new topics. We are encouraging people to follow their kids' lead and to do their best to answer the questions that their children have, as opposed to giving their children questions, if that makes sense.
Yeah.
As opposed to saying, I know you're probably feeling scared about grandma. No. Tell me how you're feeling, right? Tell me what you're thinking. Tell me what your questions are. And then doing their very best to answer the questions, age appropriate. If children are asking questions that we don't know the answer to, then to say that, right? I don't know the answer. But I think we can try to find the answer. And if the child is old enough, right, that we're encouraging people to go to the CDC website, to go to reputable locations, via the web, and to get the information that they are seeking. But in the end, if kids are asking questions specifically about being sick, being worried, which seems to be one of the things that we have, especially our littles, that are asking about, being afraid and worried about mom getting sick, dad getting sick, grandma getting sick, grandpa getting sick, those kinds of things. We're encouraging people to explain that the numbers, the percentages that people are often talking about nonstop, the inverse numbers are true as well, right? So if people are going to the hospital, for example, it's important to know that 85% of people who are contracting COVID-19 are fully recovering. It's important to know that, as opposed to focusing on the 5% who are going to the hospital and ending up in ICU, right? That it is a small percentage. And that's not to say that we want to minimize the severity of that, the fears around that, but we want to be careful that we are also kind of anchoring our children in the numbers that are more positive as opposed to the numbers that feel heavy and feel negative.
You want people to take this situation seriously, but don't be afraid.
Yeah, and exactly, to be, we want to be appropriately responding to COVID-19 for sure. It is not something to take lightly. We need to practice all the social distancing, the hand washing. That's the other thing we're talking to parents about, is to give their children something to do that can help keep them and others safe. One of those things is staying home. One of those things is washing your hands every 30 minutes, right? So we are encouraging parents, especially of children that are 6, 7, 8 years old. It's like modeling for them. Okay, it's time to wash our hands, right? Because by washing our hands, we can, in fact, reduce the spread of the virus. So giving our children even something to do. Our children, for example, children that are old enough can sit down and write letters to nurses, can sit down and draw pictures for doctors and for fire departments and for police officers, and those can be put in the mail and sent. So there are things that we can be doing with our children to help them through this very difficult time.
Okay, thank you.
The other thing, can I also say though, David, that one of the questions that we've gotten probably, I don't know, a handful of times is around children not sleeping. So children not being able to sleep. And of course, one of the things that we want to encourage parents and encourage children is, one of the things you can do to help reduce the not just the spread of the virus, but how sick people get, is by taking care of yourself, right? Eating, sleeping enough, drinking enough, those kinds of things. But a couple of the callers that we've had really are about children not sleeping and not wanting to go to sleep for fear that something bad will happen when they're sleeping. And so what we're encouraging parents to do is, it sounds like we're talking out of both sides of our mouth, because we're telling parents to try to keep routines, even though they're not in school, keep bedtimes, keep homework time and school time, do the rituals or traditions, if you will, that people have done as they manage their daily life absent COVID. But we're also telling people, which is kind of the other side of the coin, we're also telling our parents to, if necessary, to relax some of the rules. So if, for example, they have a child who is unable to sleep at night, bedtime probably isn't the issue. And we probably don't need to focus on bedtime as much as we need to focus on that this is a way that that child is trying to maintain some control. And if they need to stay up late and sleep during the day, in some ways we need to try to support our children doing that.
Okay. One of talking about stress, talking about anxiety. One thing that's been difficult, I think, for a lot of people is, some of the businesses shut down, some of the resources shut down by the Safer at Home order. For anybody who doesn't fully understand the situation, the governor issued an executive order that made a list of essential and non-essential businesses, and it said non-essential businesses have to shut down. And gyms, yoga studios, pools, things like that were included either on the governor's list or on Pinellas County issued additional guidance about pools. Parks are still open. People can still go to the parks. Playgrounds are closed just because those are a lot harder to clean and kids don't really get social distancing. So there are some resources for those physical outlets, but a lot of them are not available right now. Have you been giving any advice on how people can kind of seek a physical outlet for their stress during this time?
That hasn't actually been a call that we've received, but I think it's an excellent question, because physical exercise, as we know, is probably one of the best antidotes to, feeling overwhelmed. It is a wonderful strategy to improve one's mental health and one's mental wellness. So, I'm glad that you've asked the question. What I can tell you about that, just in talking with my colleagues and friends, my own gym, for example, is now doing virtual classes. So they post on their website every day what the exercise and what the routine needs to be, and are asking people to do that at home. I've seen on social media, Instagram, those kinds of things that people are doing, like 10 push-up challenges, where they do 10 push-ups and then they tag 10 people that they want to also do the 10 push-ups, and then they tag 10 people, that kind of thing, where you have to record yourself doing the 10 push-ups. So we are encouraging people to get outside for sure, even if it's for a 10 or 15-minute walk, but to get outside in their, if they have a front yard or a backyard, or if they live in an apartment complex, that they've at least gone down, that they're walking their dog, that they're doing some of those kinds of things to get fresh air. As you know, the CDC has reissued guidance around face masks, and now people are really encouraged and quite frankly expected to have a face mask on or a face covering when they go out. And so we're encouraging that too, that people come up with ways when they go outside to get some fresh air or some exercise, that they wear a face mask. I'm a runner myself, and you mentioned the parks. There's a park in my neighborhood where I go almost every day to run. And right after the Safe at Home order was issued, I started noticing that the parks was getting fuller. And so on a particular Saturday, I think it was right after the stay at home order was issued, and I see maybe 5 people in the park when I'm there running, because I'm there early in the morning, and I see maybe 5 people in the park. And this particular Saturday, I counted the people, and there was 190 people in the park. And so, for me, that changed where I can go to run, because it really did start to feel unsafe, that, social distancing really was not possible. Even though I was running, I mean, there were a lot of people there. So I've just come up with a different route, where I can run just kind of on the sidewalk, on the street, so that I don't necessarily have to interact and or be with other people. So I do think it's important that we continue to modify, I guess, our routines in order to practice the social distancing that we're being encouraged to practice.
Yeah. And it's probably worth noting that the governor's order, as well as Pinellas County's guidance, does still consider going outside for solitary outdoor activity as an essential activity, even for senior residents. Everybody should go and can go outside as long as they're practicing that safe social distancing, wearing a mask if they need to. And that's one of the reasons why the county parks, and I believe all the municipal parks, other than playgrounds and rec centers and beaches, are open.
Yeah. It's going to sound silly what I'm about to say, but, for some of your viewers, it might be worth mentioning that, techniques around grounding can be actually very helpful. And so what I mean by that is standing in the grass and with your bare feet, and kind of letting your feet kind of touch grass and soil, and really just doing that every day for 5 or 10 minutes. It's a grounding technique, and it might sound a little silly, but I think it's, I practice it, just because if there's any benefit at all, I want it, right? So, for some of your viewers, it might be something that could be helpful, is to go outside if they have a yard, if they have access to a yard, if they have access to a park, to take their shoes off and literally let their bare feet kind of touch the grass and the soil for 5 or 10 minutes a day.
It's something I've always liked. I've just never thought about why I liked it, but that's
Yeah.
an interesting idea. So you're from Pinellas County, right? You grew up here. Is this, have you ever seen anything like this? Have you experienced anything like this?
No, I was born and raised here. I was born at St. Anthony's Hospital. I graduated from Pinellas Park High. I went off to college, but came back shortly thereafter. And no, I think that's the these are uncharted waters, as they say, right? We are all learning as we go. And not only have I never seen anything like this, but quite frankly, I don't think anybody in our country, our globe, has ever seen anything like this. And while people may have been, our leaders may have been, thinking about how to prepare for a pandemic, I think when it actually happens, right, there's a lot of nuances that people haven't considered, simply because we haven't gone through it. Even the things that we know how to manage, for example, hurricanes. In Pinellas County, I think, I was raised here, right? And so I have very early memories of, getting prepared for a hurricane and what that meant, to my family and to my, to my routines. And so I have typically felt over the years somewhat prepared for hurricanes. I don't tend to overreact to, when the media and the news starts, 24/7 about, tracking the storm. The thing that we don't have, right, with this is we don't know how to track the storm. We don't have answers to questions that I think are fair, like, when is this going to be over? That's a question we get a lot. When is this going to be over? Another question we get a lot is, are we sure it's going to end? There's not a time factor to this. With hurricanes, we generally know, kind of this beginning, middle, and end thing. We don't know that right now. We don't know if we're in the middle of it. We don't know if we're in the beginning of it. And we're starting to hear things like, it was reported that social distancing practices may have to go through the year 2022. And so when we start hearing those kinds of that kind of information, I think that's when it starts to feel like, how sustainable is this?
Yeah.
When are we going to reopen? When are we going to reopen restaurants? We don't know the answers to that.
Yeah. Another question we have that kind of ties into that and into this being an unprecedented event is, and I'll just read it because I think that the exact wording is important for these things. Someone asked, how can I tell the difference between feeling off or sad and being clinically depressed during this pandemic, and when should I be seeking help? So that's really, I guess, a two-part question. But would you recommend that people try to self-diagnose in that way?
Self-diagnose. I mean, again, right, Dr. Google is certainly, alive and well. What I would say is, the difference between the two would probably be, some of the parameters that I would set are people who, if your sleep is being interrupted, you're not able to sleep. If your eating has been interrupted, in particular, you're not able to eat. If you have started drinking too much, if your everyday kind of take care of yourself routines are being interrupted for a continuous period of time, I do think it's time to reach out for help. Obviously, if you're having very dark thoughts, thoughts of the world ending, thoughts of suicide, thoughts of harming yourself or others, absolutely it's time to get help. One of the reasons that we started the emotional support line is, quite frankly, we don't want it to get to that place. We are encouraging people through the emotional support line, and Directions for Living's emotional support line is one support line, right? But there are others. We have, for example, 211 Tampa Bay Cares in our community. There's the 1-800 suicide prevention hotline. There are lots of anonymous call lines that people can use, and we're encouraging people to, before it gets to that point where you might need to actually seek treatment, a therapist, a physician, a psychiatrist, that you use the tools that are available to you now, just to kind of talk it through. Because sad isn't all created equal, right? So my sad and your sad might be two different things. And my anxiety and your anxiety might be two different things. And so it's difficult to do a one size fits all, but certainly we know that people can go to a very dark place, especially people who have, had dark thoughts prior to the pandemic, who lived with an anxiety disorder prior to the pandemic. And this experience, this crisis, has elevated those things, almost by 10. So it's important that we stay connected. I just can't, right, that we stay connected while we are being forced to be apart, right? It sounds like an oxymoron, but it really is incredibly important to stay connected.
Yeah. Okay. I think we had one more question come in, and we've been talking for about 45 minutes, and I'm very grateful for your time. I know you've got an organization to run. Do you have any advice for dealing with anxiety about going to the grocery store or other places where I could come into contact with the virus?
Yeah, I think that's a good question, a fair question. It is one that we are hearing quite a bit. All of the things that our leaders are recommending, which is, to limit the number of times that you have to go to the grocery store, avoiding, and I'm sure I'm not going to be popular when I say this, but to avoid kind of big box stores where lots of people kind of go in and out. Going earlier in the day or later in the evening, because the cleaning schedule, it tends to, especially earlier in the day, because grocery stores have cleaned all night, and going earlier in the day. Obviously wearing a mask, gloves if you have them, certainly, sanitary wipes if you don't have them, using disposable paper towels, to use the cart, doing what you can to wipe down your groceries before you bring them in the house. It's interesting. I went to the grocery store this past weekend, and I said to my husband when I got home that going to the grocery store is exhausting. It is an exhausting, because your mask, your gloves, what you're touching, wiping everything down. The thing that we are hearing about, though, that I want to mention, in addition to the fears about going to the grocery store, and I do think that there are precautions that people absolutely should be taking, because we are hearing that places like Publix and a couple others, they've had personnel that have tested positive, is people who don't have the money to go to the grocery store, people who have traditionally relied on assistance. And so I do want to say that, Directions for Living's website is updated every day. I'm certain that the Pinellas County has a website that is also updated pretty frequently with resources for our community. But there are quite a few food banks that have literally stepped up and are providing a lot of food to people, because people have lost their jobs and are struggling to make ends meet. One of the initiatives that I heard about yesterday that I think is going to be really cool, and it's starting in Pinellas, Pasco, and Hillsborough County, is restaurants that have been impacted are being contracted to come in and prepare meals that can then be delivered. Right now, it's starting for the elderly, people who are homebound and can't get out. But within the next couple of weeks, they're going to be expanding it to families. And for a very modest amount of money, I think it's like $10, people are going to be able to get 2 meals and a snack delivered to their home from various restaurants that are teaming together to help feed people. But I think going to the grocery store is certainly one concern, and then making sure people have the money and or the access to food is a secondary concern.
Okay. And many people may know this, but almost all the major grocery stores have set aside time at the beginning of their day. I think it's the first hour that most of them are open, where it's available to vulnerable populations. So the elderly, anybody with some of the conditions that might make them more vulnerable to COVID-19. Those individual grocery store hours are posted on our website, as well as a lot of those feeding resources that you mentioned.
Yeah.
And 211 Tampa Bay Cares is a great broad resource. That's more than just emotional support. That's if you need housing support, if you need feeding support. It's a pretty comprehensive database of different tools for Pinellas County residents.
Yeah.
All right. I really appreciate you taking the time to talk to us. I just wanted to end by in addition to thanking you, by asking what makes you hopeful? What are your points of optimism and brightness right now?
I feel again like we are coming together as a community. I think we are learning how to support each other differently. In some ways, I think that we as a community and as a country had gotten away from, seeing each other and talking to each other and kind of supporting one another. And I think it's provided us an opportunity to reconnect. Interestingly enough, in this way of social distancing, that we're actually having an opportunity to reconnect. I'm seeing my leadership team and my staff and my family members via Zoom more than ever, let's just say. One of the things that I'm optimistic about, just as an organization, is that we are finding tremendous efficiencies. We are actually, because of telehealth in particular, we are serving far more people than we have ever served before, because people can access kind of this teledoc or telehealth. They can access services via Zoom. So I am optimistic that we really are going to come through this. And while there are certainly going to be things that we will probably never be able to do again, or that we should think strongly about doing again, like traditions of handshaking and greetings, those kinds of greetings, I do think that we will come together as a community and be stronger for it. And I'm saying to others that, a year from now, 2 years from now, I hope that we can look back on this and say, I'm really proud. I'm proud to live in Pinellas County. I'm proud of our leadership. I'm proud that we came through this the way we did.
All right, I'm uplifted. Again, thank you. Thanks for taking the time. The emotional support line is open now, and every day, 8 a.m. to 8 p.m. Do you have the capacity to take more calls if people feel that they need to call you?
We really do. And in addition to the 50 people who've already volunteered to respond to those calls, we have dozens more staff who are kind of queuing up, like if needed, they want to be in the queue to begin answering those calls. So we have a lot of people in Pinellas County who want to help others, who want to serve, and to strengthen people as we move through this.
Great. Well, thanks again, April. I hope you have a good day and stay
Thank
safe.
you, David. Thank you. Bye-bye.
Bye.